Good morning, I am Dr. Padmasri. I am a specialist gynecologist in Narayan Hrudayalaya Hospital. I have done my masters in Royal College of Obstetricians and Gynecologists in the UK, and I am presently working here for the past 1 year. I would like to deal with certain common gynecological disorders which are seen in this part of India. They are the menstrual disorders, where you find that there can be irregular periods, which is a very common problem. The most common of the irregular periods being the polycystic ovary disease, and you also have a variety of hormonal related menstrual problems. You also see problems like heavy menstrual bleeding or irregular periods with lots of bleeding going on. These are called menstrual disorders. The other problem being discharge vaginally, it is called white discharge commonly, and many of the patients are bothered with this particular symptom. These are the two main gynecological symptoms which can be dealt with medication after thorough investigations. The investigations to check for menstrual disorders are nothing but a ultrasound scan which tells us about the size of the uterus, if there are any fibroids or any other hormone problem present. We can look at the ovaries to see if they have got any cysts on them and then treat accordingly. So, all it needs is to go to a doctor and take a ultrasound scan, following which the doctor might suggest a minor procedure called a DNC or dilatation and curettage, where you take out a specimen from the uterus and then send it off to the pathologist to check if there is any precancerous or cancerous condition. Then coming to the white discharge PV, this particular condition really bothers all the patients, because most of them are worried that it can lead to cancer or it may be a symptom of cancer. Still they are afraid to go to the doctor because they do not want to hear a negative comment from the doctor. Most of the doctors also take this as an advantage and try to suggest a hysterectomy or removal of the uterus, which is a drastic procedure for such a minor problem. What should really go on is, when a patient is bothered with a white discharge, she has to find out whether this is associated with any smell, any itching or any different color like yellowish or greenish in color. If that sort of a thing happens, she should immediately go and visit a doctor, who should then do an internal examination to see if there is any discoloration in the discharge coming from the cervix, and look at the cervical mouth and then take a sample from that particular place called a pap smear. This pap smear is again studied, putting it on under a microscope, and then we will come to know whether there is only an infection which can be treated with antibiotics or an antifungal agent,